Breach Show. I'm Donya Ziaee, and I'm here with Elle Jones in Halifax and Pam Palmater in Toronto. Martin's away tonight, but he'll be back with us next week. Hi, you two.
Hi. Hey, how's it going?
So today in the program, we're going to welcome a special guest, Dr. Ritika Goel. She's a family doctor, professor, and an advocate in healthcare justice. And she'll join our panel to talk about how governments in Canada have handled the pandemic, who they've served and who they've left behind. And we'll also chat about a piece she recently co-authored on the unfinished business of Medicare in Canada. But before we get into that, Pam, Elle, I want to check in with you two. What's caught your attention in the news this week? Is there one thing you love, one thing you hate in the news?
Yeah, well, I think this week what everybody's hating is the Roe versus Wade leak that came out of the US and the questions about what that means for abortion care in Canada. There's a lot to say about it, obviously, and people with better legal minds than me have broken it down. But one thing that really struck me is a lot of people have been talking about, this is always kind of a patchwork decision and that people should be organizing beyond it. And it really struck me that, liberals have this particular obsession with the court in a particular way. I have this rant about this, that every civil rights movie is always set in a courtroom, right? We get Amistad courtroom, Mississippi Burning courtroom, To Kill a Mockingbird, beloved of white people courtroom. So there's always this idea that whatever's wrong in society, just get it to court and the court will fix it. I just find that really interesting. And then this kind of devastation that, oh no, the court's going to rule against us. And obviously it's a huge the implications of it are huge, but as many people have pointed out, people always should have been organizing beyond that decision. People should have been organizing to put other things in place because we know how fragile the court is. And it just depends on, Trump coming in and appointing 3 justices. So I just found that really interesting, right? That just the way we hold up the court space is the only place we can find justice and the only decision that can guide our lives, and then almost neglect or forget to do the things outside it, even though, Roe versus Wade has been flashing for so long as something that could be overturned. So that's just my, I don't want to say 2 cents. That sounds so grandma. That's my 2 cents, and I'm sticking with it.
No, it's good because my kind of like and dislike is I like the fact that the Prime Minister made a statement saying woman's body, women's choice. I like the fact that the President of the United States said woman's body, women's choice. But that's going to translate on the ground because we know effectively women don't have access to safe abortions all over Canada right now. They certainly don't in the United States. And we know that Black and Indigenous women and young girls are often disproportionately impacted. And so while it sounds good when politicians say things like that, it really is disconnected from what's on the ground. And today, one of the ministers said, well, if Roe versus Wade gets overturned, American women can just come here, and I don't see why we can't do the procedure. Well, if they all had enough money to travel up here and they all had passports, for example, and they hadn't been previously criminalized and they have the money to pay for it, because I'm sure Canada's not going to do it for free, then we wouldn't have a problem. But that really is so detached from the very lived realities of impoverished peoples and racialized peoples and how they can access things like that.
And then you think of in the Maritimes where we just got abortion access in PEI. Mm-hmm. People have been talking about abortion access in New Brunswick, as if Canada has this flawless abortion access where everybody can just get abortions, as if the waiting list isn't huge in many places. You can only get it in hospitals, so this is very typical Canada too, as well, that, again, we represent ourselves on the global stage as the refuge from the terrible problems of the US, forgetting how we're still working on these issues too.
Yeah, and I think you raised a really good point, Elle, around not always just relying on the court or the fact that a decision's been made. Human rights are very fragile. You can work for decades to get human rights in place, and then it can be repealed in one day by a certain political party or a certain government. So we should never kind of rest easy that, a decision's been made or there's a piece of legislation, because it can change in a heartbeat. And that's why always having, boots on the ground, always having organizing, always having plan B, C, and D is important, especially for things like this.
And it'll be interesting to watch how this decision plays out in Canada. And I'm specifically thinking of the Conservative leadership race. On Tuesday, when Chrystia Freeland spoke in Parliament about the decision being overturned. She got the standing ovation, apparently, by everyone except most Conservative MPs on the floor. But we also know that in Canada, something like 70% of all Canadians support having abortion rights. So it'll be interesting to watch as the leadership race kicks off next week, what that's going to look like.
Yeah, and the interesting thing is we've always been told that it's a kind of bait and switch. They're never actually going to do it. They just say it to, get right-wing voters, but then they never do it. But then we've seen that it actually apparently is being overturned. So same thing in Canada, like we always have to resist smug Canadian complacency, right? Like, oh, they'll never do it. And so many things that we're told would never be done are done. So as Pam said, we have to really stay on top of it, right? And continue, especially like, we're told that women have rights now, what are you even talking about in the feminist movement anymore? We're post-feminist now, this idea that we've arrived, and we know that, like, never mind still having equality, we still don't have a lot of these basic rights like readily available to us.
Elle, what's one thing you love this week?
Well, I think it's always hard, like, other than animal news, I like puppy rescue videos, but one piece of news that, oh man, puppy rescue videos are the perfect narrative. Like, I recommend them. They're amazing. You just watch the dog is sad and then it gets rescued and now it's happy. It's perfect. Moving on. Yeah. There's still fallout from the Royals' trip to the Caribbean, obviously. So this is part of the Jubilee. And one thing that I've been, as a dedicated Queen and monarchy hater, watching the backlash to that has been quite funny and interesting. So a mayor in Jamaica actually foy-popped, like A-tipped, the cost of the royal visit. And it turns out it was like $8 million for them to just walk around Jamaica, including $4 million on a dinner. So people are furious, obviously. The pandemic completely hit Jamaican tourism, and they weren't able to have things like CERB. This is a country that's been stripped of its resources. All the resources have been going into tourism, right? Stripping of the local industry. And so people are pointing out, like, people can't get fed here and we're paying, like, what is in that dinner? So what I like about it is, Barbados got rid of the Queen. Now the Caribbean, of course, across the Caribbean are really talking about leaving the Commonwealth, removing the Queen of Head of State. The reparations movement in the Caribbean is huge and growing. So just to see, these acts of historical justice come forth and people really turning on the monarchy and saying, like, enough, we're done. Like, it's time for new forms of freedom. So I'm appreciating that.
And just for listeners who may not know the acronym, when you say this person A-tipped the Royals.
Oh, just like a freedom of information. So they just asked for the cost, right? Yeah. Which is a kind of like counter surveillance as well, right? From people who have been surveyed and under the monarchy's boot. My mom, born in Trinidad, they had to march around on Empire Day. Here we're like, May 2-4 weekend. It's so fun. Like, go to the cottage. And in the Caribbean or in any colonized nation, it was when the governor came and you had to march around waving the Union Jack and like singing that Britain wouldn't be slaves, as, you were the descendant of slaves, right? So, this is like in my mother's lifetime, the colonized stood under that gaze in the hot sun. So to see people now turning those instruments and asking basic questions like, why are you spending this kind of money to bring these people here?
All right. Well, thanks, guys. And we're going to keep watching some of these stories over the next week. And as I mentioned, we are also closely watching the federal Conservative leadership race. And they've got a leaders debate coming up next week on Wednesday, May 11th. And for our listeners and audience at home, if you want to hear what we all think of all of that, we're going to be coming to you live from YouTube with a special broadcast next week to analyze and dissect the debate. That'll be next Wednesday night, so make sure you've signed up for notifications about our show. Go to breachmedia.ca/the show to get email alerts. I want to welcome our guest, Ritika Goel. Dr. Goel is a family physician and an assistant professor at the University of Toronto, and she spent years doing organizing and advocacy at the intersection of health and social justice. She's worked with Canadian Doctors for Medicare, the Decent Work and Health Network, and Doctors for Defunding the Police. Ritika has been closely following the impact of pandemic policies on marginalized communities, and she recently co-authored a piece on the state of Medicare in Canada. Ritika, welcome to the program.
Thanks for having me.
Hi.
Hi.
You're our first panelist.
Yeah.
Yes, a first for the
Definitely
show.
exciting.
We've already forgotten about Martin.
Yeah, who needs Martin?
That's mean.
So we're more than 2 years into this pandemic now, in the midst of a sixth wave, and reports are suggesting that by now almost half of all Canadians may have been infected with COVID at one point or another. Hospitals are still at breaking point. Healthcare workers are suffering from widespread burnout. And yet, our governments are scrapping public health measures, reopening businesses, lifting vaccine mandates in almost every province, and getting rid of vaccine passports. It's really hard not to feel like we're all being abandoned and left to fend for ourselves, especially people who are most at risk. Ritika, I want to start with you. I mean, how did we get to this point where our governments have decided that we're basically all going to just, quote unquote, live with COVID?
Yeah, I think what we've seen over the past 2 years is over and over governments and politicians treating what is a pandemic and what is in many ways an illustration of what happens when we don't approach policies with social solidarity in mind. We see the outcomes that we're seeing exactly in this pandemic. In a way, we're seeing exactly what people in the housing system, in the shelter system, in the prison system, in the healthcare system have been saying would happen because the systems have been at a breaking point for so long. Before COVID hit, the healthcare system was operating at near 100% capacity. We never really had surge capacity built into the system. We had people that couldn't access affordable housing. The shelter system and the prison system had people living in deplorable conditions, migrant workers living in deplorable conditions, Indigenous communities with huge overcrowding. And so we've seen really exactly the people who've been most marginalized by these systems, by these governments, be most disproportionately impacted. They're the ones who've gotten sickest. They're the ones who have suffered the most, and that's what continues to happen today.
And so much of how the government has handled the pandemic has been about emphasizing, individual actions like wash your hands, socially distance, wear a mask, stay at home, get vaccinated. How far has that approach gotten us?
Not too far. I think even that is problematic in terms of who's able to follow these instructions. So if we look all the way back to March 2020, when the primary way people were being told to deal with the issue before the vaccine was just to distance, distancing is not something that's available to people that are living in overcrowded situations. It's not available if you're living in a shelter. It's not available for new immigrant families that have, by definition, to live in overcrowded situations. And when we talk about masking, who's able to afford the masks that we know are most effective, like KN95s and N95s, who's left wearing the cloth masks? There's never been really a conversation, even with those individual measures, about who has access to what parts of those. And something similar with the vaccine. Have we invested funds into ensuring that communities that understandably do not trust the healthcare system can actually get good information? Have we given our public health system enough funding? Here in Ontario, before COVID, Doug Ford had slashed the public health system, and we never really recovered from that. So those are even the individual measures which are problematic on their own. But of course, we haven't seen what we really need, which is the broad public policy approaches that actually explain why people get sick. So it doesn't matter how much you distance, how much you mask, how much you wash your hands if you're working in a crowded manufacturing plant. It doesn't matter if you're forced to go to work at a migrant farm, where at baseline, we know that labor laws were not being followed, and we know that people were, facing medical repatriation. And it doesn't matter if you're living in the shelter system and you're not able to access the supports that you need to access. So we need the government to be using, our resources. These are our collective resources, and they should be using them to change public policy, to bring in paid sick days so people can actually go home and be with their families. There was research done that showed that people were choosing were choosing to come in sick because they really didn't have any option not to, done by Peel Public Health, looking at many of the factories in the Greater Toronto area where we know there were outbreaks. People chose to go in when they had symptoms. People even chose to go in sometimes knowing that they had tested positive because they had no other choice. And so time and again, we have called for paid sick days, we've called for decent wages, we've called for actual accessible housing and proper funding to the healthcare system, but that's not what's being put in place.
Yeah, and rather than just approaching the pandemic with healthcare policies, it's pretty clear that we need social policies. And you mentioned the fact that social distancing and a lot of these other precautions were really impossible to do for a lot of different communities. And Elle, I wanted to ask you, when the pandemic first started, places like prisons and shelters were basically petri dishes for the spread of infection because of how overcrowded they are and how vulnerable the populations inside already are. As someone who's been involved with organizing with prisoners, you made the case very early on for decarceration, the release of prisoners as an appropriate pandemic response. Can you talk a little bit about that and how the criminal justice system has handled COVID?
Yeah, so provincially, Nova Scotia is actually a so-called leader in this area in that we let 41% of people go during the first wave of the pandemic from provincial prisons, but we didn't see anything federally. I don't even know if half a dozen people ended up released federally. There was no mass releasing at all. And one of the things that's frustrating at this point is, people were told if they got vaccinated, because a lot of people obviously are in prison, like the same nursing staff that's, disciplining you for like cheeking your drugs, or you're being stripped naked after you go to get methadone. Now those same people are telling you, well, you trust us, we're going to vaccinate you. So obviously there's a lot of distrust, and you have a lot of Indigenous and Black communities in prison that have cultural and historical reasons to mistrust. And they were told that if you guys get vaccinated, then maybe you can resume programs, you can do visits, you can do these things. So a lot of people got vaccinated. And what we're seeing right now happening is frustrating because provincially, for example, they've reintroduced double bunking. So it's okay to be in the cell with somebody else because I guess COVID is over. But then federally, every time there's a case, the visits are cut. People were supposed to have, be able to go out to halfway houses and stuff. And the way that they're managing it in our halfway houses in prisons right now is if somebody gets COVID, they just shut the range down or the house down, but it just passes from person to person, and they wait till the last person is infected and then quarantine for 2 more weeks. So this can go on forever because you have one person, then 5 days later somebody else gets sick, then 3 days later somebody else gets sick, and it's just going on and on and on. So federally, right now there's 40 cases in Dorchester apparently, which is a minimum security prison, and people have been waiting years to get out to just get into the community visits, have had those cut, and they don't know when that's coming back. All the education programs, lawyer visits, counseling, AA, all of that has been cut forever, and it was just coming back, and now it's cut again. But then, at the same time, they're also saying things like, "Oh, it's safe to be in the cell with somebody." It's it's so interesting that what it seems to be saying, of course, is you can go catch COVID in the prison. We don't care about you, but we don't want you bringing it out. So we have this extra caution that's way beyond what the health regulations actually are on quarantining if you're moving from a halfway house or if you're moving from a prison. But when you're in the prison, we're not going to protect you. So even though they say that there's PPE and there's all these things, the air vents go through the cells in provincial prison. People have been trying to stop up the air vents. They're quarantined on the same ranges as people with COVID. They're using the same phones. It's not properly cleaned by any means. It's just been a discarded population. And at the same time, a lot of coercion around getting people to follow health measures on promises, and then as usual, not following through on those promises. So a lot of people, it's made even more skeptical of the healthcare system. And I think that's ultimately so damaging because people get out of prison or jail and they don't want to engage with the doctor. They don't want to go get counseling. They don't want to do things that actually help them be well because they've experienced those in so many abusive ways.
Pam, with the sixth wave of the pandemic, COVID is obviously on the rise everywhere, but including in Indigenous communities. And last week, Patty Hajdu, the Federal Minister of Indigenous Services, had this to say about that.
We know that COVID-19 is still having a very significant impact on First Nations communities at this particular time, and I want to assure communities that Indigenous Services remains ready to help whenever and however we can. Our officials in Ottawa are working with many communities as we speak, and our regional offices are there just a phone call away if anything is needed, and there still remains funding available through the Indigenous Community Support Fund in our efforts to protect each other.
That was Federal Minister of Indigenous Services, Patty Hyde-Dunn. Pam, given that healthcare and other infrastructure in Indigenous communities have been historically chronically underfunded, how has the pandemic played out in these communities?
Well, if you think about it, like all of the outbreaks, epidemics, and pandemics throughout history have always disproportionately hit First Nations very hard for all of those reasons, the reasons of colonization, being forced to live on reserve. You can't live on country food anymore. You're living on rations, lard and flour and sugar. That's not going to make you very healthy for very long. So you've got multiple generations of being denied the ability to provide, for your own food, all of these rates of poverty, overcrowded housing, lack of clean water, lack of running water in some communities, lack of sanitation, all of these things, and then lack of access to appropriate health care on reserve or near the reserve. And then for those that have to go off reserve or who live off reserve, to be denied health care services at hospitals and clinics because of racisms and stereotypes, because there's an assumption that you're just drug seeking or that you're faking it, or like all of these kinds of stereotypes that we've found that they do against First Nations. So they get it on all fronts. And I mean, think about what happened with, H1N1 when First Nations were asking for help and they were being sent body bags, for example. They were disproportionately impacted. Now here with COVID-19, very, very early on, First Nations leaders all over the country and Native American leaders from the tribes in the U.S. were reaching out to governments saying, we see this is coming, we want to prepare, we want to stock up, we want to have emergency measures in place. And the federal government was just slow on the draw. I mean, the United Nations was already making statements well ahead of the federal government saying, listen, states and countries around the world, you need to address this crisis of COVID because it's going to hit Indigenous peoples worse and harder because of all of the history of colonization and the enforced poverty and the marginalization and all of the ways in which, as we've already discussed, where Indigenous peoples are. They're, disproportionately institutionalized in prisons, in youth corrections, in shelters, in hospitals and mental hospitals, and like a whole bunch of other places where it's not safe and it's certainly not clean. Anyone who's ever gone to a prison knows it's not just the overcrowding. It's like so unsanitary in many of the prisons and jails. So it's disproportionately impacting them. And it's interesting to listen to her say, we're just a phone call away. If only that was the case. And in fact, some of our treaties actually say that whenever there's a famine or sickness, just call the Queen and we will be right there. Well, Canada acts on the Queen's behalf right now, and they're not there.
And I think a big theme emerging from what all three of you are saying is that, the pandemic didn't emerge in Canada in a vacuum. Obviously, there have been generations of Black, Indigenous, and racialized communities in Canada whose experience of the healthcare system has been marred by racism and neglect. And you've all talked about that lack of trust in the healthcare system that's existed. And I guess, Ritika, I wanted to ask you what you think of how well the government directives around the pandemic acknowledged and addressed these legacies and that lack of trust.
I don't think they do. I think, when you make something like a vaccine available and you've underfunded the public health system and therefore there isn't really appropriate communication that's going out. And in fact, I would argue in many ways, the media has played a role to really terrify people when it comes to the vaccines. And, I would hear this every day as a primary care provider when people trust you and they ask your opinion. The amount of misinformation that people had from the media was just astounding. And they were terrified, and there were all sorts of reasons for that. But I definitely, in my clinic, in the populations that I work with, I saw the disproportionate number of folks who were Black and Indigenous. They were the people who were least likely to trust the vaccine. And sometimes, I was able to convince people based on the relationship that I have with them, but oftentimes I couldn't. And that's not a coincidence. So I see even the efforts that have been put in place to create community-specific services. Those have been efforts that have been led by the community. I haven't seen that be something that the government has acknowledged at any level to be a priority and require extra funding or extra work. I think about how when the vaccines were released, when it was the first dose, then the second dose, and the third dose, we learned no lessons. And every time it was the same people that were the most privileged, the ones who had most access to education and health literacy, tech literacy, that were able to access those vaccines, and everybody else fell behind. So, I didn't see really an equity-based approach at all. There wasn't a good acknowledgement of that.
And you've called this, and I know others have coined this term too, but a kind of vaccine Hunger Games.
Yeah, that's absolutely what it felt like, where people were just kind of figuring out however they could get access. And I can't blame somebody who's got more access to information and who feels more comfortable trusting healthcare for advocating for their family and trying to go ahead and get something that they trust. But that's why we have to have an equity-oriented approach. We have to start by really only allowing access for those who we know need it most first, or we have to make things accessible by providing locations that are most convenient for the people who most need it first, just to mitigate and to kind of know how people will react and respond, and how do we make sure that people who are working, for example, 9 to 5, how are they able to access things? What do we do with pop-up clinics that really only would announce that they were available a day or two before? How are people who are working, who have to arrange childcare, supposed to manage things like that? So there were many ways in which even we could see that we didn't learn any lessons as the waves continued, as the vaccines appeared, 1, 2, 3, and now 4. So it's been really disheartening to see that, and I guess in many ways not really surprising.
And Elle, you mentioned when you were talking about the prison population how the way these policies panned out and these responses panned out have actually worsened people's trust in the vaccine, in public health authorities. I guess I'm curious if you could say more about what you think will be some of the outcomes of what a lot of more marginalized communities have experienced during the pandemic.
Well, yeah, it's difficult, right? Because obviously part of this freedom convoy stuff, and I know there was an article recently where, they're talking about how COVID has allowed freedom to, emerge as this right-wing talking point. And we've seen this in the freedom convoy. And, so there was that where it was very much this very surface level, like, how dare you tell me I can't get on a plane, or how dare you tell me I can't go to this restaurant, versus, people that are in real situations of, Black people, of course, remember Tuskegee, like medical experimentation on Black and Indigenous communities is not a myth. This is something that Indigenous women are still being sterilized by the medical profession, right? So you have all of this mistrust, and you think of then, people in shelters and prisons that constantly have authorities, whether that's, trying to get a clean drug supply. And there's, of course, been that whole pandemic that we don't even talk about, which is the death by toxic drug supply that has been taking place at the same time. People that don't trust social workers and doctors because of their experiences. And so we've had all this attention directed at, this privileged, like, spoiled group of people that's throwing a tantrum in public, but that's very serious. And we need to take them seriously. We need to understand where they're coming from, because this is a political force. And if we don't listen to them and think about them, then, all of that. But then you have all these other groups of people dealing with trauma, and many of whom have got vaccinated anyway. Like, even though they don't necessarily feel great about it, they have questions. A lot of people have done it to protect their families and communities. But that relationship with healthcare, especially when, like, I don't know how other provinces are, but, we had this very authoritarian relationship that people were really into with like our, like chief doctors. This is happening in a lot of places, especially early in the pandemic, where there's this almost like fetishization of like the daddy doctor that would like come out and yell at us. And this like made some people feel safe, right? They'd be like, stay home and get, like being berated, and for some people this really works because I think authority makes some people feel secure, but for other people it was quite off-putting, right? And of course, like stay home. Well, what, in my home in housing where I have 4 generations living in my home, and we can't get access to anything else in housing. Like, it's one thing to stay home in your home with a yard and a trampoline and a basement that you can go to send the kids and multiple floors. It's another thing to stay home in a 1-bedroom, like in a building that looks out over a dumpster and be told like, well, you shouldn't even go in the lobby because that's a congregate space, right? Like these are very different things. So I don't know that we've even thought about what that's going to be moving forward for how people think about basic things like going to the hospital or going to their doctor or, trusting the teacher in the school not to inform on them, right? Like there's this whole other kind of network of surveillance. What we wanted was for people to understand collective safety and work together, but often that got morphed into like real forms of surveillance and that we haven't really spoken about, right? Because this airspace has gotten so taken over by the right wing that I think we're scared to talk about the ways that it was like Black kids getting surveyed on playgrounds. It was a Black doctor in New Brunswick being publicly named by the premier and like ran out of the province, even though he didn't even cause COVID. It was a Black university student in PEI that was actually arrested and put in jail for breaking quarantine. In Nova Scotia, it was North Preston that was publicly blamed by our premier and by the chief doctor for allegedly spreading COVID and being selfish and partying, right? Like, so these things all happened particularly earliest in the pandemic where there was a real thirst for people to like police their neighbors instead of educating people, instead of gently trying to like understand this. Like there was just this thirst for like call the cops on people, police the pandemic, ticket people, fine people. And then all of a sudden we just switched into like an anti-mask movement that became white, but the people who were actually being surveyed have been Black people and Indigenous people and housed people and people that were using drugs, right? Like, and sex workers and queer people, the usual people.
And then meanwhile, you have racialized healthcare workers. I mean, our healthcare sector is predominantly occupied by women and racialized workers. They're being harassed by this far-right supremacist anti-mask, anti-vax movement, whether it was in Ottawa or elsewhere. And this is on top of what I imagine is the trauma that a lot of these frontline workers are already feeling, having to treat patients day in and day out in a very poorly managed pandemic. We know that there's been mass burnout among healthcare workers. Ritika, I wanted to ask you, I mean, how much has the government done to prioritize the needs of healthcare workers in all of this and make sure that their working conditions are actually commensurate with the immense value that they're providing all of us in their services?
I think, at the start, there was a lot of lip service. There was a lot of, support and kind of rah-rah healthcare workers. I think the people, just as in anything, if you look at the healthcare system, we have to think about who is the most marginalized within the healthcare system, even among healthcare workers. It's, PSWs working in long-term care who are disproportionately racialized women that got COVID in the first wave, in the first few waves. If you look at nurses, nurses are the ones that are really shouldering a lot of the care work day in and day out. And we see nurses are burnt out. They're leaving the profession in droves. And we're hearing about shortages all the time, staffing shortages happening in hospitals. So, whatever is being offered, it is definitely not enough, and certainly not to the people who most need it, who have shouldered the burden most of the pandemic, which, is similar to what we're talking about in general, not just in the healthcare system, but outside the healthcare system in terms of who is always disproportionately impacted versus, I will also say, versus who kind of gets the spotlight. It's usually physicians that are the ones that we hear from who are in healthcare, probably the most privileged group. Of course, I'm one of them, but I recognize, the need for us to be able to say that we have to center the margins even within healthcare, even within workers, and the people we are least hearing from are the ones who are suffering the most.
We're chatting with Dr. Ritika Goel, a family physician and assistant professor at the University of Toronto, and she's joined our panel to talk about the intersections of healthcare and social justice. We've been talking about the government's pandemic response and how it's left marginalized communities behind, but this inequity didn't start with COVID. And Ritika, you recently co-authored a piece on the unfinished business of Medicare in Canada, and I just want us to spend a few minutes talking about that. You know, we have this notion in Canada, this sense of pride in our public healthcare system, almost again that kind of smugness we talked about earlier in relation to abortion in our earlier segment. But you outlined some of the critical gaps that we have in our Medicare system. And I wondered if you could tell us a little bit about that and what some of the contradictions are that you see.
Definitely. I think in Canada, we tend to compare ourselves to the US, and really we should be comparing ourselves to countries that have more of a publicly funded healthcare system than we do. So, you know, while we have public funding for some people, for some things, we do not really have a universal system in the way that people like to think of it. In Canada, an estimated 500,000 people are not covered by the Medicare system that are uninsured in one way or another. That includes folks who are new immigrants, people who may be here on various visas like temporary foreign workers that fall in and out of status, as well as those who are completely undocumented despite living in Canada for decades at times. And then we also have a parallel system for many folks, including for refugee claimants, including for Indigenous people in this country. And that leads to a lot of challenges. It leads to just lack of familiarity with healthcare providers with these parallel systems. And often it leads to, not the same funding, essentially not the same funding for not the same services. That's just who's covered. And then there's also what's covered. So while we have a public healthcare system, it really only is for hospital and physician services. And we're really the only country in the OECD that has a broad public healthcare system that does not include medications in that system, which is why we so urgently need a national pharmacare program. And we need one that is truly universal and expansive that will cover everybody for all medically necessary medications. So we have to be careful right now while this is being debated that the language of pharmacare does not get taken up in a way that is not a truly universal program. Similarly, we don't cover dental care, optometry, physiotherapy. There's so many services that really are key to health and health care that are currently not a part of our system. And we call this a racial justice agenda for Medicare because, of course, those needs disproportionately fall among racialized communities. When you look at who disproportionately does not have dental insurance, does not have drug coverage, it is racialized communities that are disproportionately impacted.
Pam, when it comes to First Nations in particular, there are vast differences in what they have access to when it comes to Medicare in Canada compared to the rest of the people in the country. Can you walk us through some of the systemic barriers and exclusions there?
Yeah, that's a really good point because it impacts First Nations in two ways. One, in the ways of what their uninsured benefits cover for them and what they don't. And we know from the history and all of the access to information requests that most of the requests for things like dental work or, other kind of health aids were being routinely just dismissed, and the appeals were also being dismissed. And then, we know from the Canadian Human Rights Tribunal case that they were grossly underfunded as well in comparison to what Canadians are funded for similar services. And then many First Nations were falling through the cracks, right? Especially those that were living off reserve or had to get services off the reserve. So some didn't get any services. So, there's been some progress on that front. However, what hasn't really been addressed is, even for the things that we are legally covered for, is the impact of systemic racism in the healthcare system. So we know from reports like the Royal Commission on Aboriginal Peoples and the National Inquiry into Murdered and Missing Indigenous Women and Girls and inquiries that have happened in coroner's reports and inquests in different provinces, but most recently, the report that the BC did on racism in its healthcare system. And they found, like after interviewing thousands of people and documented hundreds and hundreds of cases in hospitals, in clinics, in every form of healthcare, that the racism in healthcare is Indigenous specific, and within Indigenous peoples of First Nations, Métis, and Inuit, it's First Nations specific. And then within First Nations, women are disproportionately targeted in the healthcare system, and that it limits access to regular treatment systems, and also is a place for surveillance, like what Elle was saying, surveillance and collaboration with police authorities, child welfare authorities, and also a place of violence where forced sterilizations and forced abortions are still happening, where you have doctors, nurses, and police officers in a room saying you have to get sterilized or you don't get your kids back or we'll take your kids. So there's a really like a totally different reality for First Nations people. And it's based on all of these stereotypes that Indigenous peoples are less worthy of care, that we're just drug seeking, that we're bad parents, we're abusing the health system, or we're less capable of taking care of ourselves. And here's what's happened, like the real harm that it causes. So a lot of people think racism or systemic racism, is about political correctness or the woke culture. But systemic racism in healthcare for First Nations people in particular, and especially women, means, you're treated in a very racist and derogatory way. You're actually called names. You can not get service at all. They just make you wait so long that you eventually leave. Like think of what happened to Brian Sinclair in Manitoba. They don't talk to Indigenous patients. They're not getting informed consent or consent at all for procedures like sterilizations. They don't believe Indigenous peoples when they present with issues, or they minimize their concerns. They treat Indigenous peoples as though they should be tougher than everybody else, so their pain management is less than everybody else, and they get rough treatment. They've been sexually assaulted and physically assaulted and suffered injuries in emergency rooms and things like that. So it kills people. Like racism in healthcare is killing Native people. It has been. We've done lots of inquiries on it, but it hasn't improved. And so, that's in addition to what we are or are not covered for under Medicare or uninsured health benefits. And that's like the real crisis for us in healthcare.
Just to bring this to a close, we've been talking about, all these racist exclusions in Medicare, but then even more broadly, how, as Pam was just saying, systemic racism is embedded within our entire healthcare system. Everything from diagnosis to treatment to the quality of care to outcomes. I guess I want to hear your thoughts on what you think it's going to take to actually root out this racism in our healthcare system.
Well, two things. So one is that, studies of doctors have shown, similarly to Indigenous people, that actual doctors that have been through like actual medical school believe things like Black people have thicker skin than everybody else, that Black people have lower pain, which is a stereotype that exists from enslavement, that we don't feel pain in the same way. So they've done these questions, and like actual doctors that went to accredited medical schools believe all this, even stuff like giving like Black babies like low APGAR scores because Black babies will have like melanin concentration. They're like labeling. Actually, when I was born, my mom told me, because my dad's white and my mom's Black, and like because my eyes are like they thought that I might have like Down syndrome when I was born, like literally because they couldn't like comprehend, because this is like in England, they couldn't comprehend like a brown baby, and they were like, something's wrong with her eyes. My mom's like, no, like that's just like our heritage, like our eyes look like that, and I'm not 500 years old. I'm not a time traveler. Like this happened when I was born, so it shows that still within medical school education, right? People are somehow picking up and learning these, so not somehow because it's embedded in the system. But then the other thing is, we were talking off the top about, the health minister and others saying, come to Canada if you need an abortion, like we'll open our doors. But of course, migrant people don't have health care in Canada. People without status, people facing deportation, who've been stripped of status. I worked a case with someone with terminal cancer, and we had to fight for months to get them out of jail. They were on immigration detention, and they're not entitled to any medical care. So we've had to fundraise, we've had to go through groups to get somebody like palliative care, because they actually don't have that right. And this is someone with stage 4 cancer that, by the way, progressed because the jail refused to take them to hospital for months when they were bleeding, passing out, losing weight, all of this happening. And it took months for them to even go to the hospital and get a scan. So we know that there's different medical systems in Canada. So again, like much like we'll signal, like we're taking Ukrainian refugees and then like not taking people from countries we're bombing, you know, countries that we are interfering with, not taking brown people and Black people. We'll be like, come here to get an abortion from the States because that makes us look like cool and better. But there's migrant women who are like sexually assaulted by their employers who need healthcare and abortions and all kinds of care and can't get it, right? And people have huge debts, like $500,000 of debt from like going to get medical treatment and not being able to pay for it because they don't have coverage. So, you know, what can we do about that? Like, we actually need to have free and fully funded healthcare. And if COVID showed us anything, the health of the richest of us is only worth as much as the health of the so-called lowest of us, right? Because if somebody gets, as COVID showed us, it only takes one person to get an infection, like, and it can spread to everybody. So it doesn't matter how good the healthcare is for most of us if it's not good for all of us. And like, if COVID showed us anything, it's that we need, everybody needs to have the same level of adequate, accessible healthcare treatment. And if they don't, then the next pandemic and the next and the next, it's going to be the same thing.
We'll end it there. Thanks to all of you. Thanks, Ritika, for joining us today. It was great to have you.
Thanks for having me.
Bye-bye. This week, a new report came out on systemic racism in the military, and here's what Defense Minister Anita Anand had to say about that.
The reality is that systemic racism exists in our institution, and we need to root it out, and we need to eliminate it. And in fact, everywhere I go, people say they want more Canada. And to deliver that, we need to attract more people to our armed forces. And we need an armed forces that looks like Canada.
3 environments, 1 force. Navy, ready to help. Army, strong and proud. Air Force, rise above. This is how the Canadian Armed Forces promotes itself. And their motto is equally compelling. Train for your true calling. But what is the military's true calling, you might ask? Well, amongst other things, rape and sexual assault. Sound harsh? Imagine how harsh it is for women in the military who have been sexually harassed, assaulted, or raped while the guys got away with it. And before you all say, oh, but there's a few bad apples in every bunch, let's actually talk about the numbers. More than 25% of women in the military have been sexually assaulted during their career. And that's according to an external review that was released in 2015. And in a force that's over 70,000 members. That's 14,000 women. Those numbers demolish the bad apple theory. And this same report noted that sex was used as a way to enforce power relationships and punish members of a unit. Fast forward to the present, and only 13 senior military officials have been investigated or forced to retire. As part of the $900 million class action settlement, the Minister of Natural Defense apologized to members of the force who had been sexually assaulted. She promised that not only is change possible, it's already underway. I'm sorry, what? Where is the underway? Where is the change? I mean, none of this problem is news. In 1998, more than 20 years ago, Maclean's reported on women who had come forward to talk about being sexually assaulted in the military. What was the military's motto back then? Charge me and I'll lie about it. And then women came forward, they were disbelieved, traumatized, or even punished themselves. Go to senior officials, you say? Well, that hasn't been effective because a survey in 2012 showed that the vast majority of predator men are actually senior officials from higher ranks. And not surprisingly, Indigenous and racialized women were disproportionately targeted. So they're both racist and sexist. Then in 2014, Maclean's did another investigation which showed that sexualized violence is rampant in the military at a rate of more than 5 sexual assaults a day. And they didn't just target women. The Canadian Forces Cadet Program had hundreds of cases of sexual assault, abuse, and harassment of children. A problem that's been known for decades. Their class action suit resulted in a settlement of only $10 million. But again, no substantive change in the military. As of today, more than 19,000 military personnel have submitted claims under the class action settlement. But if that wasn't bad enough, and that's horrendous, last week a new report was released by the Minister of National Defense's advisory panel confirming for the 100th time that there is systemic racism and discrimination in the military. So just how exactly are recruits supposed to fulfill their true calling by enlisting in the force? What would attract anyone to a long-standing culture of racism, harassment, and sexualized violence? Justice Deschamps was clear when she concluded that without broad-scale cultural reform, policy reform is unlikely to be effective. And if all of this sounds eerily similar to the many reports on sexualized violence and racism in the RCMP, that's because it is. It's long past time to clean house in these male-dominated, racist, sexually violent organizations. These predators dishonor the men and women who have lost their lives fighting to protect this country. So the real question is, will we ever see a government fulfill its true calling to stand up for Canadians and protect them from predators? I doubt it.
That's our show for today. Thanks to all of you who tuned in. Make sure to join us next Wednesday night for our live stream show covering the Conservative leadership debate with our usual panelists. You won't want to miss that. Go to breachmedia.ca/the show to sign up for alerts and updates. If you haven't already, subscribe to our channel on YouTube, and please make sure to like this video. And if you're listening to the podcast version, please don't forget to rate, like, and share. And if you want to sustain this show and other journalism by The Breach, please consider becoming a paying member. You can do that at breachmedia.ca. And before we go, I just want to give a quick shout out to our senior video producer, Sarah Wiley, who's leaving us this week. Thank you, Sarah, for all your work with The Breach Show. You're going to be missed, and we wish you well. I'm Donya Ziaee, signing off for all of us at The Breach Show. Until next time.